that. That's cool.
Yeah, so it's really awesome. Great guy, great wife, great family. Hosted me out in the States. Awesome people. 7:30. It's Friday, October 29th, year of the COVID 2021. And let's bring our good friend, Dr. Peter Lombard, in from the KUAM News Zoom room. Doc, I'm going to steal your line, but we got to quit meeting like this. Just once. I want you to come on and talk about, like, the blue light glasses again or something.
Yeah, let's go back to that. That was more fun.
Yeah, and I mean
it's hard.
It's
hard to keep caring and even want to pay attention. I'm just tired of it. And you really could, if you didn't listen to the news, you really wouldn't know necessarily what was going on. I think most people generally have an idea that things are still kind of bad out there, even if they hear sort of peripherally about another death or two or three. Hospitals still got cases, but if you didn't want to and you really just were sick of it, you could really shut it out and go about your day and not really know that there's anything really that different other than you having to wear a mask in public, right?
Yeah, that's unfortunate, because when we do have public health on and we do ask them what do we need to do to bring down the cases, they always say the same thing. I could predict what they're going to say. Wear your mask, wash your hands, watch your distance. But at this point, yeah, you're absolutely right, Doc. People are just doing what they're doing.
Did you see the job fair flyer that they sent out?
Yeah, there's a public health job fair flyer, and that's happening tomorrow, right?
Yeah, I'm not sure what day it is, but I thought that was curious, the timing. They're hiring for analysts and people to help with contact tracing, and maybe that would have been nice to have done a couple months ago to really bolster the number of bodies that have there to try to get things done. But better late than never.
Yeah,
obviously.
I mean,
it is what it is.
Yeah, Doc, I mean, I lost track. I want to say we're in like week 15 or 16 of this surge, but you're absolutely right. I mean, look at this tale of two islands. They get over in the NMI, no community transmission for what, like 200 days, Bree?
Yeah, 200 days.
They get 3 positive cases. The governor, I mean, some would say it's a hard pivot, but he shuts down the schools. I mean, we get 3 deaths in the night. We don't even get a video. You know what I mean? I just don't get it. It's clear that we're not changing anything. I mean,
yeah.
Anyway, 7:32. I know you. I feel you, Doc. I'm tired of it too. I am, but I still care deeply. I know that the governor was quoted in other media saying is like people just got to get used to it, but I just think that's callous. It's insensitive, and I'm not saying let's stop our lives because there's COVID, but I mean obviously something should have been done a while ago. That being said, let's go ahead and get right into it. We got the screen share. Dr. Peter Lombard. Good morning.
Morning. How much time do we have?
Go for it.
All right. Well, we'll just jump into it and just look at how Guam's doing right now. I think it's been about 3 weeks since the last time I was on. I caught the presentation yesterday too that Dr. Pavetsky did a nice job again. And she presented some other stuff that wasn't on her PDF that was kind of interesting too, which we'll go over. But you may not know this, but Guam is actually leading the nation, if you don't count Palau, and fully vaccinated. This is just a screenshot from the New York Times just last night, and I think we're actually 73%. So again, it really begs the question: is what's going on here? Why are things? Why are we having such a hard time controlling the surge? And kudos to all of us for getting to this level. And as much as we bemoan the people that are still unvaccinated, we're actually doing a fairly good job compared to the rest of the United States. And the only silver lining there for me is if we were not this highly vaccinated, our surge would have been that much worse, and we'd have even more deaths. So that's the only positive takeaway I have here. Things would have been so much worse. Also interesting, Puerto Rico, you can see up here, they're doing phenomenally well. And you talk about another tale of two islands. Puerto Rico is just killing it. I mean, their case rates, their death rates are super low. Also, you can even look at Hawaii, and they've got similarly good numbers. It is curious to see some of these other highly vaccinated states, though. Some of them are also still struggling with I wouldn't say struggling, but their hospitalization rates, the breakthrough percentage in fully vaccinated, that is similar to what we're seeing in Guam. And I think that's a trend we're going to see everywhere. So here we are in Guam. We've got, you can see this trend going down here. over the past, I guess it started in early September. So we're fully 3 months into the surge now. And we've decreased, and if you look at the slope of this, we're decreasing by about a third from our peak over the course, about a third every month. We're going down by a third. And so that pegs us by New Year's. If we go down at the same rate, we'll still have about 20 new cases a day by New Year's, and it's better than where we are now. And probably at that level, we'll only see one death every week or so, I think, based on the numbers. So, that's how things are shaping up right now if we don't change anything. Now, if we do, I do think that some things like increasing vaccination and we start vaccinating kids when that becomes available to us, I think that will speed things along for us. And just, I think part of the tacit acceptance is that we're increasing this hybrid immunity, and that's going to help us too. Actually, I think our rates will start to come down a little bit more as well. Puerto Rico, again, just in comparison, very low down here. They had a little wave in the beginning, a little one in the spring, early summer, and a really tiny Delta wave, and they're just doing phenomenally in Puerto Rico. So how do we compare? This is the 50 worst countries in the world, and Guam would fall out right about here. We're sitting around 60 cases per 100,000 per day per capita. So this is all per capita. So we're still sort of sitting in that top 10 to 15 in terms of cases with this current surge. And I just wanted to pull up another island nation, Barbados, about twice, maybe extra 100,000 people over Guam. Biggest difference there is their vaccination rate is only maybe 50%. So you can see how much worse things could be. And globally, the United States obviously is doing much better overall. Florida is now one of the best in the country with regards to cases per day per capita. But globally, the cases are going up again, mostly because of Russia and Eastern Europe. So we see this worldwide. One place settles down, another place starts to pick up again, and we're going to keep seeing this until the majority of the globe is vaccinated. And if you look back, if you go back 4 months and you say what percentage of all our vaccinated people were vaccinated 4 months ago or previously, that would put us, it's actually a staggeringly high number. 75% of all the people vaccinated in Guam it's already been 4 months. And I think, when you look at, Dr. Povetsky's data, most of the breakthrough cases are happening at 4.5 months.
Right.
And then if you go back, if you say, well, at 50% of everybody vaccinated, it's already been 7 months since their vaccination. So this waning immunity in terms of just the efficacy to prevent us from getting infected at all and transmitting to others is absolutely playing a role here. So this really speaks to one of the primary things I want to just take home today is, please, everybody get your boosters. Everybody, as soon as you're authorized to get your boosters, please do, because the booster efficacy, as we'll see, is phenomenal. Right. And I really think the narrative is going to change. I think that there's even a chance that the official fully vaccinated term will apply to 3 doses. I think this is, I think it could be considered 3-dose vaccine, which isn't unusual. I mean, we've got 6 mandatory childhood vaccines that are 3-dose vaccines. It's not unusual. We just didn't know at the time because these were new vaccines, and we needed to do something to try to decrease the number of deaths that we're seeing. So I think that's the one of the main key points I want to take home here is that everybody needs to get their boosters.
Right on, Doc. Before we continue, I just wanted to kind of do you think that there should be more of an effort with the messaging to promote this idea? Because I totally agree. I mean, we're very vulnerable, very exposed because, like you said, many of our people who are fully vaccinated are at the tail end of the strength of that vaccination, and they need that booster, which if you look at the data, drives the efficacy up to in the 90%, right?
96%.
Correct.
It's insane. Yeah.
So why aren't we hearing on the radio, on the TV, everywhere, get your booster, get your booster? I mean, we can't even get public health on the show to encourage people to get their booster.
We had Dr. Bob.
Oh, we had Dr. Bob, yeah. But I'm just saying, the messaging to me.
I hope that's coming. I mean, again, 50% of us, it's already been 7 months. So, that's a lot of people that can get their boosters if they meet, the criteria. And I think they're probably going to wait until CDC puts out more, makes it a little bit more liberal in terms of who can get the booster shots, and that's an interesting space to watch over the next month or two. But I think that's going to be something that needs to be driven home a little bit more, as people need to get their booster shots, and it should be considered. I think we got to accept this should be considered a 3-dose vaccine, and we may need an annual booster, just like we do for the flu after that. So that's probably what we're looking at long term for living with the virus at a level that's not going to overwhelm us, and it's going to be at a level where the deaths per year are going to be something that we do have to live with at that point, because we've done everything we can. So this was a slide from Dr. Povetsky's presentation, and just to show, I was sort of expecting to see already a little bit of an increase in the percentage of all cases as being breakthrough, but we're not really seeing that so far. And she showed another slide that showed since July, since the Delta wave started, and it really hasn't changed a whole lot. We sort of, with our cases, we've been hovering between 40 to 60%. Hospitalization, I think 30 to 40%. It's been fairly stable, and death rate, I think 10 to 15%. And that is actually very consistent with what we're seeing in other states, especially other well-vaccinated states. So if there's any place that we are alike other states, it's the rate or the percentage of breakthrough cases. Not quite. Some places like Hawaii, though, that percentage is still quite a bit lower. But I think they're all going in the same direction. If they can get their boosters in before that happens, then they won't have the same problem that we are right now. This is another one of her slides that she showed. This was actually, I don't think it was on the PDF, but on her spreadsheet. So I just took a screenshot of that. This shows all the hospitalizations since the pandemic started, and the deaths and the ICU. ICU is in the brown at the bottom, hospitalizations in the red, and the deaths are hard to see. They're way at the bottom. But even though we've had a really bad surge, the hospitalization rates proportionally to the cases isn't as bad as it was in the first wave. And it's a little bit more striking. I overlaid the cases that we've seen in the Delta wave. And despite having 2 to 3 times more cases in the community, and we're probably picking up more than we did in the first wave, the hospitalization rate and the death rate and ICU rate has been fairly flat. So that is a very clear picture of the efficacy of the vaccines in Guam. And if we didn't do that, the red and the brown and the black here on the bottom would be 2, 3, 4, 5, maybe 6 times higher than that. So, thank you, Guam, for getting us to this point. And despite the badness that we see out there and the continued deaths, that's the good news. So we've talked about the waning immunity. This was a recent study that was published. This was over 600,000 VA records were audited. And this looked at people with breakthrough infections based on the type of vaccine that they got. And it is striking. The efficacy look at the Johnson & Johnson vaccine drops to almost 0 by 6 months. Almost 0. That's like not getting the vaccine at all. And that's the one dose. So I think that the Johnson & Johnson is going to be considered a 2-dose vaccine with boosters. But then, we'll look at the booster data, and if you've got Johnson & Johnson, you're much better off getting a booster dose of one of the mRNA vaccines. It's just so much more protective in terms of efficacy. And we were seeing this also, we've talked about this before, Moderna is looking a little bit better than Pfizer. It's not a huge difference, but it may be enough that people would be interested in leaning towards Moderna over Pfizer. But you can clearly see by 6 months that the efficacy against infection, and this was infection diagnosed by PCR. So they definitely had the virus, in their airways. We don't know how symptomatic they were. It didn't break it down to those numbers, but you can clearly see that the waning effect is very profound, and why again we need to vaccinate. We need to boost everybody we can. Here's CDC data now. Unfortunately, they haven't updated this beyond September, but you can see the difference here showing up too in terms of the number of breakthrough deaths by vaccine type, and it follows that same pattern. So breakthrough cases and deaths. The Moderna is a little bit better than the Pfizer, they're both better than the Johnson & Johnson. Early Israeli data. This is 2 months out from they've been boosting for 2 months now, and look at the difference here with 3 shots in blue compared to 2 shots in yellow versus unvaccinated. I mean, it's just a profound difference and improvement when you get that booster shot. And then there was also a mix and match study that was published, which showed that if you've had the Moderna, getting a Moderna booster, a 3rd dose of Moderna is a little bit better than Pfizer, which is definitely better than getting the Johnson & Johnson as your booster. If you've had the Johnson & Johnson, getting either the Moderna or the Pfizer mRNA is tremendously better than getting another Johnson & Johnson booster. So when it comes to the Johnson & Johnson folks, I mean, yes, another Johnson & Johnson booster will help you, but it's nowhere near the efficacy that you get if you boost it with, if you mix it up and you boost it with one of the mRNA vaccines. And then the Pfizer matches Moderna. Moderna booster with Pfizer is a little bit better than the Pfizer booster, but I wouldn't be too, I'd say if you've had the Pfizer, get whatever you can, as either the Moderna or the Pfizer. I don't think it matters a whole lot there. The only caveats to this study, it was pre-Delta, so and we don't know yet how quickly these effects are going to wane. If you look at the, if you take a curve like we saw here, and you saw what the efficacy was here, and you just kind of extrapolate that, well, we're boosting the baseline back up to 96% again. Is it going to fall off at the same rate again? And we're boosting to a higher level, so it should take longer to wane, but that's still one of the unknowns. And maybe some of the skeptics will be up in arms about that. Well, like I said, then I think we just have to accept that it's going to be an annual booster here. Hopefully, maybe it's every 2 years. But we don't know yet because this is still new. This is boosting is still new. We only have 2 to 3 months data on boosting right now. We'll have to wait and see. There was a first randomized clinical trial of booster shots that were published by Pfizer. Actually, it hasn't been published yet, but they had 10,000 people with a 2.5-month follow-up from the booster shot, and this is where that 96% comes from. So 96% effective against Delta. So there's this question of, well, shouldn't we already be revamping the vaccine for the booster? Well, even though we haven't revamped it, it's still extremely protective against Delta. Now, if we can do it, great. I mean, it might be even better than this, would just be phenomenal. And these numbers are, I can understand people would say this is almost too good to believe. Well, it is what it is. It is the data, and again, we don't want to be too optimistic. Again, we don't know how long this is going to last, but we at least want to show what's actually being seen out there. And this was interesting too, because in this trial, there was 11 months between the 2nd dose and the 3rd dose. So that really shows that even though you probably wane down pretty low with efficacy, it goes up tremendously just with that single booster. So that was almost like an annual booster right there. And just to remind everybody, I hope nobody really gets too up in arms about the thought that this could be just considered a 3-dose vaccine, as we have so many vaccines which are 3 or more doses that we've just accepted that's the way it is. That's what it takes. This is how immunology works in our bodies, and I hope it's not a surprise. And if the messaging was a little bit unfair earlier, that we hyped the vaccine that it was too good, I don't think that was the case personally, but I can understand why some people would think that way. But let's just have to accept what the reality is of this vaccine and what it can do for us right now. And of course, we already give influenza annually too, so I hope that's not a sticking point for some people too, that we're going to have to get a booster probably every year. I wanted to switch gears and talk about kids real quick. So these are all the pediatric deaths we've seen with COVID. I think 700 or so in the last 2 years since the pandemic started. And look way down here, less than 1 year old, a year or less than 1 year old. I didn't realize it until looking at the slide that of all the kids that die of COVID, a large percentage, the greatest percentage, are 1 year or less. And that's, and we had that a couple infants recently, right, that died. And I understand there's they need to be looked at very closely to make sure that that's the best we have, but I don't think we typically see a lot of kids showing up DOA, pre-pandemic. Sure, SIDS is out there, sudden infant death syndrome, and I don't know how many cases we've seen in Guam, but I if it's more than what we're seeing here, I'd be shocked. And if there is COVID in the household, even if the kid's asymptomatic, it's really hard to say that there's going to be another better explanation. But
right.
I don't think we can be super confident in saying that those are definitively COVID deaths, but still, it is what it is what the data is showing us, and we have to take that into context and try to figure out what to do with that. Curiously, the 5 to 11-year-olds only make up about 2% of all the COVID deaths. So here, I think you guys know this, the FDA Advisory Committee voted in favor of allowing the vaccinations to be given to 5 to 11-year-olds. But here's the process. FDA has to give their thumbs up, and then it goes before this ACIP committee, and then the CDC and the CDC director have to sign off before it can get given to the public. So I think this process we're still looking at maybe another couple weeks before we get the green light here in Guam. But it was great to see on the presentation yesterday. They are ramping up. They've already got their orders in for 7,000 doses. So that's fantastic. And the Pfizer trial looking at the efficacy of this against symptomatic infection was about 90%, which is great. And they used about a third of the dose in adults. I think you guys know that too, which is probably very favorable considering wanting to avoid side effects of the vaccine. Rough calculation, I think about 32, the JIC report tells us 32,000 Guam residents are ineligible, and they do that little rate calculation of hospitalizations. I think about 21,000 or about 2/3 of those are in this age group of 5 to 11, and the rest are, 0 to 5, 0 to 4. But this represents about 12% of Guam's population. If we vaccinate even 80% of these, this would bump us up, 10 to 12% right there. So that would bring us up to over 83%, which would be great. I don't think that's unrealistic either. I think the majority of parents are very interested in getting their kids vaccinated. And why? I just showed you a slide that showed amongst all the peds deaths, very few of them are coming from this group 5 to 11. There's still a lot of good reasons to do it. When you look at the age breakdown of cases in the community, a lot of those are in this age group. Okay, and if hospitalized, 1/3 of these kids end up in the ICU. If they're sick enough to have to be hospitalized, they're also so sick that they have to go to the ICU for a number of them. This inflammatory syndrome, which I think we had one admission for, 60% of these at least are admitted to the ICU. So it's a very serious and severe condition that we don't want to see here, and that's even in kids that recover from Delta, at least the initial Delta infection. It's now the 6th leading cause of death for this group. So even though the numbers aren't very high, how many deaths are we willing to accept for kids at all? There's the long COVID issue is still one that we're learning about. We're still learning about. And then we want kids to stay in school. And I think the vaccine in this age group is going to go a long way towards allowing us to do that. Transmission effects. We know that kids transmit the virus and they bring it home and they transmit it to their household. So there's another reason if we keep the kids from getting infected, there's less likely to transmit. Now there's this whole other conversation about how much of a benefit is vaccination against transmission. And I think there's some very vocal people out there that say, it doesn't matter if you're vaccinated or unvaccinated, the transmission is the same in both groups. I think there's some credence to that belief, but there absolutely is. And you just have to look at the right data. If all you look at is that one study that showed that there was increased viral load in vaccinated people, that's not the complete picture. You can't just look at that one study. You've got to look at this in the context. There's been other studies that show similar viral loads, and there's other studies that show rapid clearing of that viral load in vaccinated people. And none of those studies actually take the next step and say, what does that mean about infectiousness to other people? If you're vaccinated and somebody coughs on you with COVID, it's going to probably get in your airways and start to replicate in your upper airways, but your body will then kick in and fight it off. How infective are you to other people at that point? Those are questions we don't really know 100%, but there's plenty of data that shows that if you're vaccinated, there is decreased transmission. It may not be as much as we're hoping for, but there's still absolutely is a decreased transmission in people that are vaccinated. And at least in the early Pfizer trials, there were no significant safety issues that we saw in kids, and no cases of myocarditis, which is one of the things that people are worried about. I did show this slide before, but again, this is multiple studies. Even with 4 to 6 months waning immunity, there's still 40 to 60% efficacy against infection. So, I mean, it's still very clear, even with waning immunity, that being vaccinated is very protective. of course, against severe illness, but also any illness at all. So this is a little bit depressing. So Delta, I didn't, it's hard to really reconcile this. The reproductive number, the latest estimates are like 6 to 9. So that's like, remember that number is if one infected person will infect this many other people. So it started off 2 to 3 with the regional COVID, and Delta bumped that up to like 6 to 9. That's just crazy, and you can kind of look and do some calculations and that, and basically these are very rough calculations, but if you could magically boost everybody today and bump up their immunity to 95% today, that's still, and you had no other interventions at all, no masking, nothing else, no social distancing, the reproductive number is still 2.5, greater than 1. So obviously even that's not enough based on 73% population vaccination. Conversely, if you were able to vaccinate everybody that is not vaccinated, excluding the kids right now, that only decreases the reproductive number to 3.2. So because we only have a fairly small group left that's unvaccinated, it actually would be, I think, better and easier to get people boosted than it would be to try to get these really staunch people resisting vaccination to actually accept it. Also, it was a little bit disappointing. I mean, if we only relied on vaccination, we vaccinated everybody, we would have to get to 88% to get the reproductive number less than 1. So that's kind of, I think that's why we're seeing this, you can call it moving the goalposts if you want, but Delta forced us to move the goalpost. A reproductive number of 8 is forcing us to move the goalposts. If with that reproductive number, you're going to have to get to 85, 90% community vaccination. And if that's all you want to do to mitigate, we want to stop wearing masks, we want to stop social distancing, that's where we're going to have to be to be able to get to return to that normal lifestyle. We know that places with, this speaks to the anomaly of Guam right now. Highly vaccinated states have much less deaths over the past 3 to 4 months since mid-June. This was, the state is already a little bit old. Guam was here already quite a bit higher than the rest of these states that are well vaccinated. Now we're more like up here. We're up to over 50 deaths per 100,000 since June. And it's kind of like, I think Florida's up here as an anomaly too. I think there's certain places where you might see a different sort of curve based on uncontrolled community transmission. If you've got uncontrolled community transmission, you're just going to have more cases and more deaths. And I think that's what we're seeing. So if, in retrospect, we probably should have been a little bit more vigilant in trying to do more to get the community spread under control. So I don't know if you saw this, but this was one quick news brief, but there was a really well-designed clinical trial that showed this very inexpensive treatment. It's actually an SSRI it's used to treat depression. A short course, 2 to 3 weeks or something, showed pretty significant effects. So we think it has to do with some sort of anti-inflammatory effects. But people are looking for other things besides vaccination. Well, here's another one, which I think is probably going to come down and be I think it'll actually be recommended at some point by the major organizations. But we'll see how that plays out. Interestingly, I did a quick look at the cost of vaccination versus treatment. Of course, if you're admitted to the hospital, it's extremely expensive. Monoclonal antibody treatment is over $2,000 per dose, and this is the price per dose of the vaccine. So here we have it, and it's free. It's free for us. I mean, if you want it, you can get it for free. It's no charge. Yeah. The government is subsidizing the vaccine. So again, just from a cost perspective and something, there is no greater way that we can impact and get to what we want to be a normal, more normalcy than to be vaccinated, to vaccinate as much of the population as possible, and to get the boosters when needed. So that's it. Basically, our take-home points here. We've got 75 of our community that's vaccinated already 4 months after their second dose. And I think that we really need to push the messaging. As soon as you're eligible, get your booster with an mRNA vaccine. I think we need to consider this a 3-dose vaccine. The Delta wave is increasing at the current rate. Maybe we'll be at 20 cases a day by the year. Hopefully, it'll go faster than that. What else can we do at this point? It's great to see these new hires, but just going back to test, trace, isolate. We lost that because the community transition was just so crazy that they decided just to kind of give up on that. But with somebody with such a high reproductive number, if you can effectively trace, contact trace, and isolate people sooner, I think that goes a long way to helping control community spread. And I think we lost that early on in this surge. I definitely think there was a little bit of discussion about rapid testing, and I really think that this is if we can get a lot of rapid testing that's very cheap, I really think this can help us to be able to get to get a pack of 7 rapid tests at home, and to know if you're infective. That's what these rapid tests do. They're not as sensitive as PCR, but they'll tell you at least if you're infective. And so if you're feeling a little under the weather, or your kids has a runny nose, and you do a rapid test on them 2 or 3 days in a row, and they're negative, they're not infective, and they probably don't have COVID either. So I think it would go a long way to helping us identify people and get them isolated sooner. But again, at this point, it's like, whatever policies and mandates are there right now, they just probably aren't doing much at all. And some people say, well, why even have those mandates in place at all at this point? Right. So, and I think there's some credit for that argument as well. But things are looking better here, but not great. And I think we're going to just have to accept. Unless we make some changes, this is what we're going to see over the next few months in terms of the slow decrease in cases and deaths here. So,
very classy.
So that's the good news.
Wait, there was good news in there, Doc?
That's the good news, is that we're moving in the right direction.
Right on.
I guess that's the only good news we got.
Doc, thanks so much for your presentation,
Doc.
Especially for this last slide,
Yeah,
the take-home points.
Mm-hmm.
That's very good. Very good.
Oh my goodness. 20.
You're welcome. Thanks for having me on.
Always great. Always insightful, Doc. Let me just ask before we let you go, because you kept saying one of the recurring themes is we should have done. Is it too late to do something now? And if so, what should we do?
Well, it's never too late. And it's great that they're hiring new people, and maybe that'll help us get on top of this contact tracing a little bit better. I think I have heard at least people just kind of say, "Oh, you should get tested," and they kind of roll their eyes and say they don't want to sit in line. So I don't know. It sounds like it's pretty easy to get tested, but maybe it could be even easier. Is that possible to do that? I don't know that. I've since probably a couple months ago, I've felt like we should probably restrict certain activities in the community. Again, restaurants I think are fine. I think they do a nice job, and I don't think we see significant clusters there. But we've talked about dance clubs, bars, things like that. That would be that would have been such an easy thing to do now. Is it too late for something like that? I don't know. Maybe it is. We're already trending down, but the reality is we're still going to be seeing deaths over the next month or two, and the faster we can get the community transmission under control, the quicker we can suppress those deaths. And people, there's going to be such a backlash against anything that you try to recommend at all. It is difficult to be too forceful with any of these recommendations. The reality is there's so much we don't know. You can always take 2 places that seem similar, but they've just got some other underlying issues that we can't identify completely to figure out why this is happening here in Guam, where it seems like it's been a lot easier to control the Delta wave in other places.
Right. Yeah, Doc. I mean, thank you again. Like I said, very insightful. Have a good weekend, and
Stay safe.
Happy Halloween, and stay safe. There you go, Dr. Peter Lombard. It's 8:03, guys. Let's jump over to KUAM TV on this Friday morning. This is The Link, proudly brought to you by Pacific Points, Cabo Enterprises, IT&E, and Jack in the Box.